folks, I'm Wound Care Karen. I'm a registered nurse with a passion for wound care. Now, you know, every year the United States president, he delivers the State of the Union address. Well, with all that's been going in the past few years with nursing, I thought we deserved a State of the Nursing Union address. And since I'm president of my own fan club, I nominate myself to deliver this address, but it's a big topic. So I have asked my good friend and registered nurse, Mahsa Kharazi, to join me. Mahsa, welcome, and thank you so much for doing this with me.
It's a pleasure. I'm glad to be back. This is a big doozy of a topic, and it's something that we talk about quite often in the lunchroom together. So
Yes.
I think it's really a great time to be talking about this.
I agree. Yes, the time is ripe for sure. And just to clarify, so this is January of 2023 that we are recording this session. So let's, you know what? Let's just start right out of the gate with a really difficult topic. Now, I might be like nearsighted, but this past year, it just really seemed to be rife with attacks against nurses. And I don't mean just the physical attacks, although there were plenty of those, right?
Yeah.
I mean, like the criminalization of our profession.
It's been like a witch hunt.
Yes. Cases like Redonda Vaught, the nurse in Tennessee, who was convicted in March of criminally negligent homicide and gross neglect of an impaired adult due to a fatal medication error she made in 2017. Now, her case has been a huge controversy, and we don't have time. Like, that's a whole nother podcast that other people and other people have actually done it really well. Yes.
Yeah.
We don't have time to discuss all the details today, but it highlighted and it brought to the forefront so many topics. It helped. It did help facilitate national discussion about the nursing shortage and patient safety, right? They go hand in hand. It exposed the litany of systemic failures in healthcare. Everything from the tools we use, right? The software and hardware that she needed to use to get to that medicine.
Right.
The medication dispensing system. Everything. The lack of hospital response. In fact, during one of the testimonies, I heard that so she reported it right away. She
should.
Yes, as we're all taught to.
Yes.
Right? It's because we're a just society, right? And so she reported it right away. And I heard that she was told to not document it.
You bet.
At that time.
You bet.
So, you know, the lack of the hospital response, and not just lack of, but the hiding it. You know,
so
they didn't report it. They didn't.
Quick. Can we just do a quick overview for those who, and I can't imagine that anybody who's listening to this doesn't know about it.
Right,
but just
the folks
in case
that live under a rock.
The 1 or 3 people
that have no idea what we're talking about.
So there was a Vanderbilt nurse. Quick overview of what happened is she was supposed to administer an anxiolytic, right? I think. And the pharmacy machine, so it's like an Omnicell or whatever kind of machine that dispenses the medication.
Right, Pyxis or whatever brand name they had.
Yes. That was not operational at the time. The software was down. So every nurse had to go through an override process to access medication from that machine.
Right, for a lot of meds, for every patient, every day.
Yes.
Like that was a known thing. You just knew to do it. It wasn't something you had to do once. It wasn't a rare thing. No. That's how they were operating.
It wasn't her intentionally going into the override mechanism to get the medication intentionally, you know.
Right. No,
she wasn't administer a paralytic instead of an anxiolytic.
Right. She wasn't nefariously trying to circumvent the system.
But she got punished like she did.
You're right.
So that's what happened. And then, so this woman who was the patient, and I'm so sad for her family that they've lost her. Apparently she was very sick and she was suffering. I don't want to go too far into the details because I don't want to get anything wrong. But basically the nuts and bolts of this is that this poor lady passed away. I don't know if it was actually proven through autopsy that it was this medication.
Well, that's another controversy.
Right.
Was the autopsy brushed over the fact the autopsy did not say it was because of the medication.
So now what kind of case do we have here? What is this? What is happening?
When it first happened, no, the
how is it homicide if the medication didn't kill her? I don't get it.
Yeah, well, there's a lot of things I don't get about
again,
this
so
case.
that's the overview of what the situation is that brought these criminal charges against her. Now, what was these topics that you're bringing up as far as like what this case brought out into the public forum, as far as like discussions and conversations that need to be had revolving around this? It exposed where the culpability of the administration and facility lies in a situation like this.
Because they did not report the medication error to state or federal agencies as required. They tried to brush it under the rug.
They tried to cover it up.
They agreed to a settlement with the family. They paid all that hush-hush. And it wasn't until some whistleblower, I don't know, a year or two later, mentioned it to CMS. That's when it all came out again.
And CMS is the Centers for Medicare and Medicaid Services. Yeah. So, but they're the ones who hold the coin purse.
Right. But was anyone from hospital administration or that pathologist who did the original autopsy, were any of them brought to trial?
I don't see anything about them having any kind of repercussions. And I don't know where the nursing board for that state, because normally when a medication error happens, it has this reporting sort of chain of command that it goes through, chain of custody for where the person who notices the medication error, whether it was you who performed the error or not, whoever noticed it has to report it to administration. Administration has to report it to the state.
Right.
And then the Board of Nursing, they may report that nurse or not. It's up to the facility.
Right, because it depends on the circumstance.
Right.
Was it a complete mistake? Is it a pattern?
Is it something that's a teachable moment, or
Right.
is this something that is, dangerous?
Right.
Is this a dangerous person?
Yes,
So
again,
at that point,
because up to now we've been operating, the whole nursing profession has been operating under the guise of being a just culture. They drilled this into us in nursing school. Be honest, have integrity, report your mistakes. You will not get in trouble. Report them because we need to prevent.
It's about patient care.
Exactly. Patient
safety.
Yes, we are a just culture. We will support you.
This is our oath.
Yes.
This is our oath to take care of the community in their most vulnerable of times.
Yes, exactly.
And if you are holding true to your oath and not conducting yourself in a nefarious, non-malfeasance is the word, right?
Yes. Oh, God, I feel like I'm in college.
Do you feel the pin sticking your chest right now? But if you're conducting yourself in that way and you do deserve discipline, the Board of Nursing is there to provide that for you. And if you've broken the law outside of what's under the umbrella of nursing discipline and nursing board disciplinary actions, then then that's when it goes to a criminal place. But this case seems to have circumvented all of that.
Right? Skip the Board of Nursing. Went straight to the district attorney.
What? Who's paying him? Is he running for something? I don't know.
It's just amazing. I don't know. It's, in my opinion, from what I, read and understand, I've read a lot about it. What should have happened is, she filed a med error. They should have had maybe a committee look into it. Look what happened.
Yes,
they would have seen all those failures, which were systemic failures. Yes, she made mistakes. She admits to them.
Absolutely.
She admitted them in court. She admitted them to the family. She admitted them to this day. She still admits to them. And at the very most, the Board of Nursing should have either suspended her or revoked her license, which they're certainly in power to do. Revoke her license.
Sure. Or suspended it and required her to have more education
training
for medications and things like that, which is an option that they often do.
Because the job of the Board of Nursing, and each state has a Board of Nursing, their job is to protect the community.
Yes.
Their job is to make sure that a nurse has the requirements to get a license and then the requirements to maintain that license. That's their job, is to give licenses and take them away, essentially, right?
Yes,
and it's all about public health, community health. So if they thought she did, something really wrong and was so bad and could never turn it around, then again, at most, revoke her nursing license Therefore, she will never be a nurse again. Therefore, she won't be a threat to the community.
Well, Karen, how are you going to make an example out of her if you don't send her to jail?
Right? So the whole concept of crime, the criminality of it, implies that we're, the public, we're not safe unless she's in jail. Please protect us from her. That's a crime. A crime is someone who does something bad and might do it again. So we need to put them away from society. We lock them up in prisons.
I like that we do that with the Angel of Death nurse.
Right?
But
yes.
Like that guy's a serial killer and go away.
Truly deserve it.
Yes.
Yes, he's right where he belongs, okay? Right? But yeah, so how is this a crime? Locking her away from society, what does that do? She made a mistake, a medication error. Nurses, raise your hand if you've never made a medication error. Look,
I'll tell you.
Nobody's hands are up.
I've never forgotten the first time.
Same.
And I'll never give a B vitamin without sweating a little bit.
No. Right?
It scared the crap out of me.
We've all made errors.
Yeah.
We've all reported them.
Yeah.
And thankfully, not too many of us have been accused of crimes because of it. I mean, this was a huge turning point. When I was at work when they announced the verdict. Was it in March, I think? Or and I heard it, and a coworker came up and he said, "I'm sorry, I'm getting emotional." And he said, "Did you hear?" And I said, "Yes." And I said, "This is it. Yeah. Nursing will never be the same. Ever." And I truly, truly believe that. This was...
Oh, honey.
It was a toll. The bells are tolling.
Yeah.
And I just get emotional because nursing is so central to my core.
Yeah. Yeah.
You know, and I love being a nurse, and I love my profession. I'm so proud of us. I love us. And it just scared me, and it hurt me.
Well, because we're no longer safe.
Right. Again, we're afraid
to
culture?
Make mistakes. We're afraid to admit to the mistakes that what if they come after me next?
Yes.
I have a family to feed.
Right.
I have my parents to take care of. I have a mortgage. I have all these people who I'm responsible for, and it makes me scared to make a mistake. It makes me scared to be human. Like, of course, we always go through our protocols for safety,
and the 5
like
rights
the checks,
of giving meds, and
yes,
but we
not
don't
cut
robots.
Corners like that, and
nobody's perfect.
No, it is human to err.
Yes,
right.
Absolutely. Again, that's
why the system has been built the way it is, so that it can give us that safety of, not fearing.
Nope. Report it. Tell us what happened so that we can investigate, figure out what went wrong, and prevent it from happening again.
Right, because it's about safety.
Absolutely.
Why are we here? It's about the patient.
So I was very, very proud when I saw the groundswell of support. There were nurses there every day in court with her, and that made me really, really proud, because a lot of them showed up. They spoke up for Redonda. They wore shirts, I am Redonda.
Yes, aren't we all?
Right? Who has not made a medication error?
Right. And that's not all of this isn't to take away from the absolute tragedy of a woman who has lost her life.
Right.
And a family who no longer has that loved one with them.
Agreed.
Agreed.
Yes, totally.
That's not to excuse that.
No. But
it's the way.
Exactly. And again,
we cannot conflate those two.
No.
So I think that needs to be made very, very clear.
I agree. And again, she made a mistake. Do I think she should be a nurse? No. Do I think she's a criminal? Hell no.
This is
absolutely not.
It's a completely different thing.
Right.
We're apples and oranges here, and sometimes there's a banorange. I don't know. There's a little place in the middle where they all meet.
And then another case, a Dr. Sarah Ernie. She's in California, a nurse practitioner. She has her doctorate of nurse practitioning, and she was fined in November of 2022. She was fined, almost $20,000. I think it was 19 and some change for the audacity of calling herself Dr. Sarah.
But didn't she have a doctorate of nursing?
Yes.
So she literally has a doctorate.
Yes.
And her title is Doctor of Nursing.
So apparently there's only 6 states, 6 out of 50 in the U.S. in which a nurse with a doctorate can call him or herself a doctor.
Outside of an academics.
Right, in clinical practice.
I see.
Yes.
Because there needs to be some kind of distinction between the MD doctor for the MD or DO.
Right.
Or DPM or what other kind of doctor of medical practice that you can have. And this is for the general public to understand? I'm just trying to, I'm asking a question, really. Is that where this is coming from? Why?
Yes, exactly. So in California specifically, it's some type of business law. The only folks who can call themselves doctors are medical doctors, doctor of osteopathy, optometrist, doctor of podiatry. Yes, they are allowed to call themselves doctor.
And that's because they've gone through the rigor of medical school.
Again, when was the law written? 1912?
Okay, do you let me ask you a question.
Before there were doctorates of nurse practitioner?
Do you know what medical school was like back then?
Well, I know they were all male.
I'll tell you, it wasn't no 4-year program.
Right.
It wasn't any of that. So I'm guessing that the LVN program that I went to is much like the the medical program of 1912
again,
where these laws were written.
It's just old so misogynistic law on the books that,
if it was up to that law, I'd still be wearing a skirt and pantyhose.
Yes, absolutely.
Smoking a cigarette at the nurse's station. Yeah.
So yeah, she's lost her practice. She's financially ruined. Oh, God. And again,
she's lost her practice?
Yes.
But what about her licensure?
Actually, that I haven't seen it lately, but in late November, she wrote on her GoFundMe account that the board is actually looking into her license. That's how she worded it. Yeah, here we go again. Yeah.
Are you kidding me?
I wish I were.
This woman has gone through... Mm-hmm. Okay, so for those of us who don't know what a doctor of nursing practice is...
So she's had at least 12 years of schooling.
This is somebody who's earned a bachelor's degree of nursing, master's degree, and a doctorate. So like you think of all these super smart people who have PhDs, that's that.
Exactly.
All right?
It's a terminal degree. Yes. It's the
get
highest degree you can get. It.
She can maybe get another degree in something else.
Right. Or her PhD, her philosophical degree.
PhD, yes.
In addition,
So, or PsyD. But the thing is, so I'm glad that you're bringing this up, because aside from this, when I've talked to other people about, when I was considering going on to other degree levels, that I was asked, well, why don't you just go to medical school? Oh. And I'm like, because I want to be a nurse.
Because I don't want to be a doctor?
I don't want to be a doctor. I mean, I would love to be a doctor of nursing.
Exactly.
But I don't want to be, I want to be a nurse. There's a difference between nursing practice.
Yes.
And not to say that, our medical doctors aren't good. No. We just all serve
completely different
places.
Roles. Yes.
In the role of patient care.
Yeah. Nursing
and I really love what nurses do. It's a different school of thought.
Absolutely.
And so that I think is very important to acknowledge, is that, you can be a doctor of nursing practice.
Yes, you
can. And you're still a doctor, but just not and it's in the world of medicine. So I think that maybe where some of this idea of wanting to have that separation, because the general public isn't going to be, privy to these nuances right off the bat, because they
but the 6 states that do allow it, then let me tell you how they allow it. They allow it. You're allowed to call yourself Dr. So-and-so, nurse practitioner. So you simply clarify it.
Oh, how simple.
Right? I mean, it's that simple. And so when a patient, wait, what do you mean? I'm sorry, what's nurse practitioner mean? Oh, well, that means, I'm a nurse. I've had, 12, 15, 16 years of schooling. I've been practicing for 20 years. But I'm able to write prescriptions. I can...
scope of practice than your medical doctor. We do some of our things overlap.
Yes, but I can assess you. I can diagnose you. I can prescribe tests and read lab results.
Yes,
and
I've had lots of training.
Right, exactly. And prescribe medicines. And I can still help you. Yeah. So the 6 states that do allow it, they allow it, with contingency. You say, I'm Dr. So-and-so, nurse practitioner.
We don't want anybody out there, misrepresenting who they are.
Exactly.
And it wouldn't be fair to the profession of nursing.
We're not pretending to be anything.
No.
Yeah.
Ew, it's so gross. Oh,
Keep
God.
it real.
You know what? Like, this whole thing is just like, keep your mouth shut.
But so
'Cause
remember,
it's just
again, this
not
was
right.
another district attorney who got, a fire in his pants and decided to bring charges against her. So remember that in most...
Who's he being supported by?
In most states, district attorneys are elected positions. Mm-hmm. So I want to remind everyone, we have the power to vote those people into office or out of office as we see fit.
Yeah.
So definitely
okay.
vote. So, but yeah, the physical attacks against nurses are out of control too. Yeah. There was a recent Press Ganey study, and it revealed that violence against nurses is at an all-time high. The current rate, I just fell over when I read this number. The current rate is 57 nurses get attacked every day. Every day in the United States. And I'll link this actual report in the show notes because I am not making this up. It's crazy.
Is there some kind of, I wonder if there's a comparative statistical study that'll show any other profession that gets assaulted that much in a day?
Well,
outside of being a boxer.
Well, maybe prison guards. I could see that.
Okay, but they have guns and
police.
Stuff.
You know what I
to
mean?
defend themselves.
So again,
I've got a stethoscope.
Right, military. Again, I don't want to take anything away from other professions.
No,
a lot of other professions are under attack, right?
This is true. You're right.
What I'm saying here is that attacks against nurses are on the rise, right? It's just getting crazy. And worse
yet...
Is
it really on the rise, or is it just being reported now?
Well, but the reporting system is broken. It's broken because sometimes
I've never reported any time I've gotten assaulted.
Because sometimes we're not allowed to report it. Think about it.
Yeah, I mean, and even if...
And they turn it on to us.
Oh, yeah,
Karen,
causing waves.
Karen, what did you say to make that person beat you up? Was it in your tone? How did you approach them?
Was your skirt too short? Were you walking home alone
it's
night?
Turned on us.
Yeah.
What could you have done differently to have prevented the attack? Let's have a class about that. As if somehow it's our fault.
Well, can't you understand that patient's family is going through a really hard time? Yes, they are. That doesn't mean you can punch me.
Exactly. Yes,
it doesn't
I'm
mean
not
you
your
can
punching
spit
bag.
at me.
Yeah, yes.
It doesn't mean you can even verbally assault me.
Right. So there are 4 states, 4 out of 50 that have laws that either increase criminal penalties for healthcare worker violence and or they require healthcare employers to enact safeguarding measures such as perhaps like metal detectors, extra security, et cetera, et cetera. So but there's only 4 states.
Do you know what this reminds me of? Did you hear about this recently? A psychiatric nurse practitioner was stabbed to death.
Yes.
Poor thing.
That's what I mean.
By a patient who had some kind of knife. Yes. How this patient, especially in the psych ward, your possessions aren't being searched. How did you get into the hospital with a gun? Or I'm sorry, a knife.
A knife, yeah.
And then on top of that, there was that active shooter that just happened recently around here.
Yeah.
How did this person get into the hospital all the way to even the 3rd floor?
Well, because we're not a state that has enacted either of those safeguards.
Oh, no. But there's a sign in front that says you can't bring your gun in here, though.
Oh, that's right. That really stops
That sign works.
Yeah, I see a lot of people turn away at the door and walk away. Yeah.
Yeah, it also says the non-smoking. And how many times have you gone into a patient's room and they're just lit up?
Oh my gosh.
Oh, wow. So, okay, there is a common thread. Can you see it? And all of these things that we've been talking about, there's sort of this like undercurrent of a commonality.
Right.
And I think I've probably hinted at it.
We've mentioned when you said my skirt was too short.
Yes, maybe.
Right.
I think that there's, just this sort of connective thread, a sinew of misogyny.
I agree. I totally agree.
And so do you want to go into that? Do you want to talk about it?
We have to. It's the pink elephant in the room.
Yes,
in the short skirt.
Oh boy.
Making her eyes at me.
Oh my God. How dare you wear eyelashes?
Right.
Ma'am.
But yeah, no. So historically, the nursing profession has been, heavily female, right? Mainly female.
Yeah.
And unfortunately, there's still misogyny.
Absolutely. Absolutely.
I want to say in the United States, but it's everywhere. Let's be honest, all over the world, right? So we're seen as less than. We still don't have all. We may have the rights, but the mindset hasn't changed.
No, we don't have the
mindset.
protections. So how many times have you heard? This is what I want to kind of say about all of this, as far as the undercurrent of systemic misogyny that exists in nursing, because it's not just in nursing.
Oh no,
it's in almost every area that you see is predominantly female
teaching.
Yes.
Yeah.
Right.
Yeah.
So these places where you've got a traditional role of being a caregiver and a nurturer, these are going to be mostly where you see a lot of women.
Yes.
Right.
And when we're just expected to
take it,
put up and
just
shut up.
Take it.
Yep.
And get paid less for it.
Oh. Well, gosh, yes. You're
and
just
don't
a woman.
question.
No.
And how dare you ask for more?
Right.
How dare you stand up for yourself?
Well,
you should be lucky that you're. And then you got into this because you knew what to expect.
You knew what you were getting into.
Lord have mercy. So I feel like this is, you and I we chat all the time about this kind of stuff. And I was texting you yesterday, the other day, and we were going back and forth. What did I say to you? I said, the general public has never been prepared to accept women in what people perceive to be a position of caregiving, such as nursing, mothering, teaching, etc., as being anything human outside of what the expectations of that role is. And I think that that's where a lot of this comes from, this backlash that we get is, what were we saying earlier? Damned if you do, damned if you don't.
Right. When we try to stand up for ourselves, it's that whole rote, barefoot and pregnant theme.
Yeah, absolutely.
It's like, well,
absolutely.
What do you mean, little lady? Didn't you know what you were getting into when you became a nurse?
Because when women get too powerful, things start to change, and it shifts the paradigm of power.
Right.
And so I think let me just say that these are all my opinions. Okay?
Oh, completely. Please don't send hate mail.
And you can send hate mail, but I'm not going to read it because I don't care. That you have your opinions, and if you have something that you want to say to me that is a smart discussion, and let's do that. But I'm not going to get into the whole negative garbage of it all.
Exactly.
So if you can't handle my opinion, then
I welcome open discussion about.
Let's have dialogue.
Right. Misogyny, racism, diversity, the whole bit. So male-centric professions such as the police force, doctors, the medical boards, right? Even the military, right? The good old boys club, right? They have each other's back.
Right. And
they support.
And within that, there is a stronghold against accountability. Do you know what I mean? And so when we ask for accountability from another profession, they're like, no.
Talk to the hand.
Right.
We've always done it this way. But then when we want
to be protected, and have that same kind of community and togetherness and the kind of bonds that it takes, camaraderie, and enough power of position that gives the influence to make social change and policy changes.
Yes.
This is where we get a pushback from legislation and society in general. You're seeing it with reproductive rights being attacked.
Yes.
I'm not saying it's all old white guys who are doing it, because there's some not old white guys who are saying it. Some women are out there. But it's the same message that's been purveyed from the time in our country where it was completely acceptable to own other human beings.
You're right. Yes.
All
absolutely.
Right?
Yes.
So you are, and what's the thesis? When the established structure of power is threatened, you're going to see a
pushback.
Those things are going to reverberate back into the direction of the person or the entity or these. Usually, it's women.
Yes.
Do you remember that bumper sticker that says well-behaved women rarely make history?
Right.
Because
who was that? Was that Eleanor Roosevelt?
I wish I could. I want to say you're right. It was Ellie Roosevelt.
It was someone, Some wonderful woman said that.
Some wonderful woman who went against the grain and got a shit ton of flack for it during her time because she was a non-traditional woman.
Right.
So you're seeing in this day and age when the social structure is threatened, when the old guard is moving out.
Yes.
As the boomers are aging out of policy making.
Yes.
And positions of influence and power and money.
Yeah, they're threatened, aren't they?
They're threatened.
Yes, I agree.
And so more women are moving into these positions of power, and more people of color are moving into these positions of influence.
Yes.
And what's the constant sort of theme that we're asking for is fairness and accountability and safety.
The nerve.
Oh, I know. Because that cuts into their legacy and bottom line that, somehow it's going to affect the hand-me-down that they're going to give to their children and their grandchildren.
Exactly.
And,
their
estate.
It's stripping them of power. Yeah.
Because that damages the workforce.
Yes.
You can't have a cheap workforce unless you dehumanize people. Am I lying?
No, you're absolutely
right. So that's where I think all of this is coming from. I mean, people are going to get really mad about all the things I just said. Oh, there's this really great article speaking about this that I'm going to ask you, Karen, to link into the description, into the show notes. But as far as nursing, I went on a giant tangent, didn't I? But not really. Because it's connected.
Yes, it's all connected.
So here's oh my gosh, you were gonna go wild when I read you the name of this article. Why Unions Matter for Nursing. A new study examines nursing's relationship to union organizing and feminism, as well as the profession's unique organizing challenges.
Oh wow.
So isn't that crazy? So this is a really great article, and it references another paper that is there's a new paper that came out that says More Than Handmaids: Nursing, Labor Activism, and Feminism.
Oh, I love that.
Isn't that wild?
More Than Handmaids.
Yes. So and this probably bridges us into another topic about what's been going on in New York with the union.
Yes. Yeah. Well, and just overall in general, the past couple of years, since COVID, let's be honest, right? There's a big current trend and a push towards unionization, right? Yeah.
I think I saw in one of these articles that in recently the percentage of nurses that have unionized has gone from 13% to 20% nationwide, which doesn't sound like a lot, but it's a huge number.
It is. Yeah.
It's still not.
It's 1/5 of every nurse, right, is in a union. Wow. I'm not sure how I feel about unions.
To be honest, same.
And maybe we should say, if it's not obvious, so we aren't in a union.
No.
Where we work now. I'm not sure how I feel about. I don't know if that's the answer. I know there's pros and cons.
For sure.
So,
but you come from Pennsylvania, which
I do, and
a history of being pro-union.
Oh, very union heavy.
I've grown up in Texas, which is like no union here.
But let me tell you why I feel the way I do about unions.
Okay.
Yes, I did grow up in a union heavy state, and yes, my father did work for a union for 52 years with the Pennsylvania Railroad.
Okay.
And he cursed the entire time. He absolutely hated it. Mm-hmm. He hated being in a union. Mm-hmm. And let me tell you why. My dad is a member of the greatest generation. He was born in 1927, lived through the Great Depression, he left high school at the age of 18 to go fight in World War II.
Wow.
In the South Pacific. He was a Seabee. When he came home to our small city in Pennsylvania then, he got a job with the Pennsylvania Railroad, which is a wonderful employer.
Yeah.
A great place to make a career, raise a family. It was awesome. A lot of the men in town worked for the railroad. And I don't think they were unionized when he started, but at some point, anyhow, they became unionized.
Okay.
And he really did not care for the union because, again, as a member of the greatest generation, my father was an extremely hard worker.
I can imagine the kind of work ethic.
He always had calluses on his hands.
Sure.
He was a welder.
Okay.
He always had, spots on his eyes and skin where where the little... Yes, right. In his 52 years of employment, he missed 2 days of sick time. He was off 2 days because of sickness in 52 years.
What?
He rarely took a vacation. He worked from sunup to sundown. He was an extremely hard worker, like that generation is, right? So in the union, he would always complain. He's like, yeah, I pay my union dues because they make me, but I don't benefit from it at all. In fact, the people who benefit from it are those, and I can't repeat the words he would call them, but they were the younger generation that he said, all they do is take breaks. They just want to take breaks and breaks. And he's like, he was a welder. He's like, I've finished, 20 cars and they haven't finished 3 yet. And guess who gets paid the same as me? And yet, their breaks are protected and their rights are protected.
Well, his breaks were protected too. He just didn't take them.
He didn't take them because of his culture, the way he was raised.
But he could have, and it didn't make the other ones lazy. And I think that I understand what you're saying, and I'm not fighting against what you're saying and what your dad's perspective is.
Right.
But I feel like that directly correlates to what's happening now in nursing and why there's this pushback against these labor union or the unionized nurses who are fighting for safe patient ratios and protected breaks. And, how many times have you come home after a 12-hour day and like, this is the first time I peed today?
Right.
Because you just didn't have a chance to walk away or somebody's going to die.
Right. They're not getting breaks. They're not getting their meals.
Right. Yeah. So what if that was protected? Would it make you lazy?
No.
Versus the nurse that doesn't, and works through all that stuff and makes sure that her patients are 100% and self-sacrifices.
But shouldn't labor laws protect it? In fact, I think labor laws do protect it. Like, don't labor laws say that, like, and again, it's different for every state, but within an 8-hour shift, you must have a half-hour meal break and 2 10-minute breaks. Like, don't labor laws protect it? Why do I need, so if my hospital is breaking labor law by making me work through my meals, then I should take that up with the labor board, right? Why do I need a union to protect me or speak for me?
So the idea is, and again, I'm with you in the camp of not completely sold one way or the other on a union. But I'm just going to play this devil's advocate role. So if you're not getting breaks, so you have a lot of like individual fingers of people who are being offended versus a collective group.
I see.
Who has a louder voice as a union.
Yeah, there's power in numbers.
There's power in numbers, just like what we're saying for staffing ratios. Oops, sorry. Punch the microphone.
Norma Ray, she jumped on the table, folks.
I got my sign. And handkerchief on my head. I love you, Sally Field. Oh my God, so many young people aren't going to have a freaking clue.
Oh, they have no idea what we're talking about. Oh God, did we just date ourselves?
Okay.
But no, see, again, we appreciate conscious thought and conscious conversation about we can agree to disagree. We're having an adult, mature.
Let's dialogue about it, shall we?
No harm in that.
No, this is how we learn, because I learned something about a perspective that I'd never had before.
Right. Again, we all grow up in different situations, different cultures, regions, environments, health disparities, etc. And we all have different mindsets. And until you talk about it like this in dialogue, now I'm beginning to understand because I know there's power in numbers. And again, I'm not completely anti-union either. I'm on the fence. I
totally
really
on the
am.
fence.
I really am.
Let me tell you why I'm on the fence. Can I? I'm sorry.
Yes. But tell me your perspective. I told you mine.
So I don't have any kind of context for unions at all.
Right.
I've never been in one. Why should I? I live in Texas, and as far as my work history is concerned, I was an independent business owner from the time I was 20.
You were a union of one.
I was a union of me, my mom, and my dad. All right.
That's awesome.
Kharazi Union. Anyway, okay, so like I said, as far as my work history is concerned, I don't have a context for unions because I owned a restaurant for a long time, and then I was kind of tangentially involved in real estate for a while, and then I was a stay-home mom. Ain't no union for stay-home mom, girl.
Hell no.
There's a Facebook group of some crunchy moms wanting to put the teething necklaces on the babies, which I couldn't have survived without. I had again, with the Facebook support groups, because they've been for me. I used to belong to Tattooed Hippie Pirate Moms.
So that was your union.
That was my union.
I love it.
And all we did was just like support each other and rah-rah. But there's no legislation that's going to come out of that. So anyway, so that all leads up to now I've been a nurse for a while.
Mm-hmm. Yeah.
And living in Texas, it's not really unionized at all. Up until recently, I think there was an Austin hospital that voted to start unionizing, and they're going to start their elections soon. So that's exciting for them.
Yeah.
Because it's an experiment, to be honest, as far as what do unions in Texas, or what is that going to look like for us?
How true.
Right?
How true. Yeah, exactly.
So the thing that makes me excited about it is the power to come together and have a collective voice to fight and protect for and affect policy change. Because there have been so many things that should have gone into Texas state policy as far as nursing and healthcare that just got stalled because it didn't have the right money behind it before. That's true. Yeah. Didn't have the right lobby behind it.
No. In fact,
COVID
happened
against
it.
Yes, yeah. Right. So what's, I can see the positive aspects of paying your dues to be able to go into a collective resource that will affect all of us for positive change as an industry and as a profession in this state. That's one side. The con side. In my little bit of research that I've done, I've also seen that there have been nurses out there that paid their dues and didn't get jack from it.
Yeah. Like my dad.
and furthermore, unions are an industry unto themselves.
They make money.
So union leaders, from what I've heard, aren't always healthcare providers or nurses. They're lawyers, but they don't have a context themselves for healthcare or nursing.
Having never done the job.
No.
Yeah.
So how are you going to represent my interest if you aren't one of us?
Yeah.
You know what I mean? And so, that's their job.
Yeah, they get paid. Literally.
They get paid. Yeah. This is not like a side gig they do. Like
it's not a charity. No, it's not pro bono.
No. And you're not getting paid on the side because this is, like you have a main job and then you're on a committee for being in a union. That's not how this is. No. Labor union leaders, and not just nursing, in any kind of
any union. Yes.
The labor union leader is a paid position.
Yeah. And that was another thing my dad always complained about. He's like, it's just another money-making scheme.
Right.
Again, and they take them all the money from the bottom, right? And it just all fills the pockets at the top.
Right. And so in theory, it should be that this money is going into a collective source bank for our voices and influence to get translated into policy and effective change for us as on the floor.
Right. Again, that's the theory behind it. That's the theory. Because again, money is power.
And in some places, it works in some places.
Yes, I agree. Yes.
But in so many places, they've found collusion between the union leaders and administration against the better interests of the nursing. Yeah. So it's I don't know what's best. Yeah. That's why I'm on the fence.
And then didn't we hear in the news recently that a certain nurses union, they were celebrating because they had won the bargaining agreement. They got raises. They got some benefits and stuff.
They forgot to ask about the benefits, actually.
Come to find out, yes, they actually lost some of their benefits, such as jury duty pay, military pay,
which I thought that was legal.
Some type of maternity
pay.
To. I thought so too, but again, maybe it was a different state. I can't remember. I will link it in the show notes, I promise. We did research this stuff, folks. I promise. There was so much out there.
It's a lot.
But yeah, so it turns out they actually lost some benefits because they didn't remember to put them in the...
Right, because it was a newbie union. Yes. That's why I'm interested in seeing what goes down at... what's the Austin?
Seton.
Yeah.
You'll let them go first.
Have you ever been at
work the bugs out for me, will you?
Have you ever been at the red light to go under an overpass, and the light turns green, but you don't go. You wait for the other people to go just in case some asshole comes through the intersection. Like, I'm not going to be that guy.
You don't want to be first out of the gate, huh?
No. All right.
So, but the whole point, the unions are in the whole conversation in the minds of nurses is because of this whole, what do we call it? Staffing crisis, bedside crisis. What is it? It's not a shortage.
No, there are plenty of nurses out there.
shortage.
They just don't want to deal with you. They're finding ways to work from home because they're sick of this.
Because they don't want to
get
put
punched
up with
again. I don't want to get peed on again.
Right, being physically abused, working short staff, working through lunch, not getting your breaks.
Right.
And
Overtime's great, but if it's mandatory, not so much.
Right. Yeah, exactly. Let me volunteer for overtime.
I would like to have a choice in this.
Yes.
Since just because you give me a paycheck doesn't mean you own me. Yes. And I think that this is where it comes. Just because I have a caretaking job doesn't mean I'm obligated to subject myself to abuse.
Right. And that I don't need self-help. You know what I mean?
Right.
Just because I'm a caretaker does not mean that I also need care.
I am not a human. I'm not a vessel for your, garbage for me to just take it and, I'm not your dumping ground.
Yes. So now this was happening even before the pandemic.
Boy,
right?
it's gotten worse.
Being honest.
Since. Yeah.
Right. The pandemic it's made it worse and it brought it to light. Right.
Remember that nurse who got punched in the grocery store?
Yes. Oh
and this was shortly after COVID broke out, and she was afraid, but she just finished a long shift, and she needed to get some milk and eggs and cheese for her family. And
so she wore her scrubs.
She wore her scrubs into the store. She wore a mask.
Yeah.
And somebody hauled off and punched her.
Yeah, because she was spreading China virus.
Yes.
I totally remember that.
Oh my God.
Yes.
China virus, as far as that was said facetiously, we don't really think it.
No,
was.
I was mocking a former president.
Who?
But and think about it. Boomers are getting older.
Yeah,
right?
Yeah.
Right?
Gen X, all of us.
So they need more care. Mm-hmm. Even Gen X, we're getting old.
Well, yeah, but now we were on the floor, and now we're moving into the positions of administration and management.
Exactly, yes.
And
I'll be honest.
Taking care of our boomer parents.
I haven't worked the floor since the 90s. Right, exactly. Yes. I've been in administration since the 2000s, and now I'm in administration in outpatient even. So I'm even more removed from the bedside. So that's why I want to make it very clear. I haven't worked bedside in a very long time, and I don't want to speak for bedside nurses.
Well, Karen, hold on. I know you're saying what you're saying.
Mm-hmm.
And yes, it's true that you're removed from the bedside in the sense of that the kind of intensity of floor nursing in the hospital in the various departments.
Yes.
But even because I work with you, you're my boss.
I'm a girl boss.
You're a bad bitch. Boss ass bitch. But you don't sit behind your desk. You do see patients.
I do.
And the level of outpatient care that we do specifically in wound care is very intensive. It can be.
I agree. And it's
you're
increased
in there
since the pandemic.
100%.
No,
100%.
I agree.
So I just want to put that out there for you so that the public knows, and you need to take the credit for what it is.
Well, thank you.
That's me hyping you up. Thank you.
Thank you.
Yeah.
Thank you. But in my opinion, bedside nurses and nursing home nurses, in my opinion, have it the worst right now of all of us.
Yeah. Yeah.
So I just want to be a voice for them.
Sure.
As best I can. We need all the voices. We need to lift each other up.
For the RNs, for the LVNs, for the CNAs, for the,
all the healthcare workers, the medical social workers. My God.
Oh my gosh.
All of us.
Case managers.
The respiratory therapists. We are not leaving you out. The physical therapists, occupational therapists, and assistants. Mm-hmm. We need to lift each other up.
Even transport.
So now during the pandemic then, this huge wave of travel nursing came in.
Oh yeah.
Right?
Yeah.
And it was cool for a very short while because a lot of travel nurses were able to make a lot of really cool, good money.
Well, and they
working
got to
their tails
feel
off.
Like they got to go and be part of something.
They were part of something, but they worked their tails off. They literally risked their lives.
Absolutely, 100%.
But they were well compensated for it.
Sure.
For the most part. But then you hear of things like, well, I was promised such and such, but the contract was pulled from me. It just, gold ever lasts, right? Or is it the opposite? Gold always. Sorry, pony boy.
I don't.
So anyhow, whatever the euphemism is, the good times didn't last, right? And so now I think it's getting even worse for travel nurses, unfortunately, because I think their contracts are being pulled faster and their salaries, unfortunately, are taking a hit because, the COVID is dying down a little bit.
So do you want to hear the other thing, though?
Yes.
As far as travel nursing is concerned, I saw a TikTok. Gotta love the TikTok nurses. And I'm sure we'll get into that here in a minute, too.
Right.
But I saw a TikTok nurse that was saying, since when did travel nursing, like the things that you can choose to go, like assignments,
yes,
include strike work on a regular, as a regular assignment instead of a special assignment.
Again,
that'll tell you something.
It just speaks to how many nurses are trying to become unionized. Yeah. We're at DEFCON 4, folks.
Yeah, babe. I mean, and I know you got emotional saying it earlier when you were talking about this is, we're watching our profession circle the drain, and it is not friendly.
Yeah. No, we're at war.
Yes.
We fought in many battles. Some of them we won. We were the heroes of COVID.
Oh, yeah.
We were the heroes of the
Pots
pandemic.
and pans and everything, and you're a hero.
7:30 every night in New York, baby.
I had a friend who was out there who took up she's a nurse practitioner here in Texas.
Okay.
And she went to New York and spent some months out there.
Right.
I think it was the majority of the summer, to be honest. Or maybe it started in February and she didn't come back until the summer.
Wow.
And she was she got a little monthly B&B thing, Airbnb thing, and in the morning and in the night there were pots and pans, and she would sit out on her little fire escape and call me, and I would listen to it. And she didn't function as a nurse practitioner there. She was on the ICU.
She was an ICU nurse. Yeah.
So
we were heroes for a very short time. We were heroes.
Yeah. But I think that this backlash is related to this, to be honest. I really do.
Because of the whole how dare we?
Okay, we gave you an inch. Now you want a mile, girl? Are you kidding?
Oh my gosh.
I'm just like the nerve. Yeah, no. We put ourselves on the line and we didn't even get freaking hazard pay.
No.
Very few.
No.
My girl at the 7-Eleven got the hazard pay, and she deserved it.
Right. The people at the big box stores got hazard pay. Some local grocery stores got hazard. And
absolutely.
Again, they were frontline workers.
Yes.
They worked through every day. How many days was our clinic closed for COVID?
I don't think we had one.
None.
Yeah.
We were open the entire time.
Yeah.
How many times a week did we receive a phone call and say, "Oh, hi, my dad was in there yesterday and you took care
Almost
of
every day.
That wound on his neck. We just found out that he has COVID."
We would have a call like that almost every day.
Right?
Yeah. And
we were frontline workers.
And my parents who are vulnerable.
Yes.
Because they both have hypertension and diabetes and other
the comorbidities, right?
Yes. They live with me. Mm-hmm. My children who were unvaccinated because there wasn't a vaccine at the time.
For children, yes.
Live with me.
Yes.
And I had to go to work and come home and pray that I wasn't going to be the one to kill my family.
Right. Yeah. How much hazard pay did you get for that? Was it?
Oh, was there hazard pay? I didn't get that. Did you get that? I didn't get that. I had to pay the bill is what I had to pay.
Well, so I know a bunch of nurses at a certain facility. They got a letter. They're so excited. They got an email in July.
This past July?
Yeah, July 28. And they're like, "Oh, we really appreciate everything you did, and you're our heroes, and all the RNs and LPNs are going to get raises. Yay, congratulations."
Oh, wow.
Yeah, they're so excited. They haven't gotten it yet.
Have they gotten the...
This is January of 2023.
Wow.
So some of them,
July.
They went to HR, right?
Okay.
And, they're asking their bosses, right there in the unit. They're like, "Yeah, where's our rate?" But the email says we're getting a raise. "Oh, well, it's coming. So then they finally went to HR and said, they actually took the letter. So I got this letter saying I'd get a raise. Give me that. And the HR person said, Oh yeah. Well, we're giving it out in waves, in phases.
Was there any kind of explanation or
so then they
rationale
said,
that was provided? What's the structure of the wave?
Can you tell me what my phase? Because an employee can only ask about themselves, right? They can't.
Yes.
Well, why did tell? No. So the employee says, "Well, okay. Can you tell me what phase I'm in and when I can expect?" No, I can't do that.
Why isn't there transparency?
Well, you can't or you won't. So to this day. day, those nurses, which, by the way, half of them have left.
Oh my God.
To this day, those nurses.
Nursing shortage much?
They're going where the money is, baby.
Wow. And there's nothing wrong with that. That doesn't mean that you're a greedy nurse. That means you have a family and you know your worth and you should be paid.
Absolutely.
What you
Absolutely
are worth. What is industry because from what I understand, I think I've heard about this because it's not just this hospital that you're talking about. I think there have been a couple.
Yeah, because I think it was system wide.
Yeah,
right.
Okay.
You know how much maybe the public doesn't know, but a lot of hospitals are owned by corporations that actually own like a system of hospitals.
Yes, right.
So yeah,
right.
I'm pretty sure it was system wide.
Wow.
Yeah, there's nothing wrong with knowing your value and insisting on getting paid what you're worth. And with the crisis right now, so many hospitals are offering recruitment bonuses, right? Come and work for me.
Yes.
You'll get a $10,000, $20,000 bonus, etc. I mean, my emails are just flooded with all of these offers.
Same.
To go here, get this bonus, get that. There's nothing wrong with that. Nothing wrong with knowing your value and getting paid what you're worth. We all have bills to pay.
Yes.
Some of us have children. Many of us are still paying on student loans,
Absolutely.
etc. For whatever reason, there's nothing wrong with getting paid what you think you're worth. That's for sure.
Absolutely. I mean, and again, that goes back to the point that we were making before as far as like this pushback that we're getting in the nursing industry in general as being perceived as these people who are just in it for the money and just fighting for the increased pay, and we just want more and more and more and more. Isn't it enough that you're a hero? Now you want more? It's
crazy.
But no, that's not what. And here's the thing. If you are telling me about this situation where these nurses who have been promised a standard industry wage increase, right, and they're being shut out, in those cases, the union would be the collective bargaining entity to prevent a situation like this from even happening.
That's true, because
and it
right
forces
now,
transparency.
Again, power in numbers. Because right now, only a single employee can go to HR and talk, again, just for themselves.
Why the veil? Right. What are they? I mean,
well, and
what's done in the shadows is supposed to be. I don't.
Right.
Get it.
Well, and it's the whole. You're not supposed to talk about your wages with each other.
But that's illegal. That's actually illegal.
I know it now because of TikTok. Thank you. But thanks, TikTok. And let me mention, and this is one of the things that I love about nursing is it allowed me as a single mother, to raise a child in relative comfort. I mean, we're so blessed.
That's not a common story, ma'am.
No.
Yep.
But that's what the nursing profession allowed me to do.
Yeah. Yep.
I could live a lifestyle that I wanted to.
Yep.
Now, school was hard. Nursing school was hard.
Boy,
I worked for it. I earned every freaking penny, and I still do.
You sure do. Yeah.
And there's no shame in that. But that's the cool thing about the nursing profession is you can make decent money.
Yes.
I was
as you should
mother.
For what we're required and asked to do.
Imagine that. Hey folks, Wound Care Karen here. I have to break in with a little addendum as I'm editing. This podcast was recorded prior to the announcement of Operation Nightingale, the fraudulent nursing diploma scheme in Florida. So you're going to hear Mahsa and I talk about the low NCLEX passing rates in Florida. And we seem a little bit confused, but now in hindsight, this is probably a large contributing factor. So, I mean, it just goes to show week to week, month to month, we've got these big news stories just directly affecting the nursing profession. So keep that in mind as you listen on. So let's talk about nursing education.
Boy, let me tell you something. Have you heard about what happened in Florida? What they're saying?
No, what happened?
Okay, so I wish I had the actual numbers in front of me, but for whatever reason, those notes are gone.
We'll link it in the show notes.
Yes. So from what I understand, there was an article I read very, very recently that Florida in general, and so this isn't just a particular nursing school, because there can be several nursing school, independent and through
public,
like colleges,
public and private,
community colleges, state colleges, and private education nursing school entities, right?
Yeah.
Statewide, they are the worst numbers. They're putting out the worst numbers as far as the number of graduates that do not go on to pass the NCLEX. That's the national exam for nursing licensure.
The pass rates.
The pass rates are abysmal.
Oh my gosh.
It's the worst in the country, and it's the worst that the state has ever experienced. And it's lending itself towards that own state's
crisis,
nursing shortage crisis.
Yes, exactly.
You know, because they can't get these nurses educated well enough to pass the exam. So they're passing school.
Yeah, they're becoming GNs, graduate nurses.
Right.
Yes.
But that doesn't mean anything unless you can get past the exam. And that's for the LPN, LVN, and that's the licensed practical or vocational nurse, depending on the state, and registered nurses, RNs.
Oh, wow. It was both levels?
Across the board.
Oh, wow. That's
across the board. So what's going on in Florida that is the disconnect between education and the pass rates for the exam?
Right.
How are they?
So, but do you think, did the pandemic have anything to do
Absolutely.
with that?
100%.
Because, well, you can speak to this.
I
you
sure
were
can.
in nursing school in the pandemic.
I started out as an LVN.
Right.
And that was in 2012. And then just in the past few years, I started the road and got on my prereqs to get back and get my RN. So our local San Antonio Community College, whoop, whoop, I love them so much.
Yes.
I got my RN through there. And so...
Well, you got your ADN, right? Your
associates.
Degree. Yes, sorry.
Yes, so thank you for clarifying. So yeah, ADN through their RN program.
Okay, awesome.
And I registered, I started the program in 2019, and then what happened?
Oh boy.
We got the COVID. We got the Rona. And so an integral part of a successful nursing education program at any level is being able to have hands-on clinical resources outside of just a lab and dummies.
Right.
You need real people.
Annie, you okay? For
are you kidding?
Don't know, that's our CPR dummies that we practice on.
Annie, are you okay? Are you okay, Annie?
But yeah, no. And especially, again...
Doing wound care on Seymour butts. Yeah.
And for the folks that don't know, Seymour Butts is this sweet little model of a butt, and he has wounds all over, and that's how we practice wound care. And his
every school
name is Seymour Butts. Yes,
everyone has one.
But again, hands-on
is real people.
Yes.
Following a nurse, an experienced nurse, and even some not so experienced nurses out there, so you can get because everyone who's ever been through nursing school at any level and has passed the NCLEX and then finally hit the floor will tell you do not learn how to be a nurse in nursing school. No ma'am, that is OJT.
On the job.
Yes.
Right, because it's so hands-on. You need to touch the skin, smell the smells, hear the sounds, see the chest rising.
See the tears in someone's eyes, hear the differences in real life instead of through the audio of the raspiness and then the wheezing and the rattling.
This is wheezing.
What does it feel like when someone is infiltrated? What do you do when someone's turning blue in front of you? On paper, but you don't know until you're there. So the clinical experience was robbed from us.
Oh my God.
I got some, and I'm lucky that I've had a lot of different levels of floor and patient care experiences, I've had it all. Good. Because a lot of my classmates in my cohort for the ADN program, they didn't. They were babies that were coming from, just a non-medical background.
Right.
And so they didn't have...
they didn't have the advantage of being an LVN.
Right. Yes, okay. And I was in a bridge program, so it was an LVN to RN program, but they were babies still. Or they were nurses that work for insurance companies, so they're pushing paper. Yeah. And they know great things as far as policies and insurance coding and stuff like that, but they don't.
So the pandemic hit and you couldn't go to your clinicals.
No, we started off and then they wouldn't let it. And I wanted to be there. I'm like, this is where you need us the most right now.
Put me in a gown and mask.
But they didn't have the PPE to give to us. And they were just trying to figure out where the liability was. This was all new. Right. It was all new. We didn't know anything about this virus
You're
or
right.
how it was going to affect people.
Yeah.
Who was going to be responsible? Was it going to be the hospital or was it going to be the school if one of us got sick and died?
Got sick. Yes. Okay. I see.
And so the state made a dispensation for us to be able to do virtual,
like simulation
sims and stuff like that. So there were more papers than I could have gotten my master's already with the amount of papers I've had to write for just my associate's degree to make up for the lack of clinical experience. But in Florida, I think, so that's just my piece of the pie from a personal,
having gone to nursing school through a pandemic.
Right. And then on top of that, I went through bachelor's program through the pandemic as well.
Yes. And I did that too.
Yes, you did.
Yeah. So towards the end of my bachelor, I did a 26-year bachelor program.
Oh.
I graduated with a diploma.
Shouldn't call you doctor.
Graduated with from a diploma program in 1994, and I would go to school off and on. I always meant to get my BSN, and I would go to school off and on. And but it literally took me 26 years to finish my BSN.
Sure.
But that last year was just as the pandemic was hitting, and I actually missed because it was my community hours. Here's the irony, right? So I needed like 90 community hours.
Yes.
Going to clinics and homeless shelters and just community hours, right? I needed 90 of them, and the pandemic hit.
Not going anywhere.
Couldn't go anywhere.
No.
So that did delay my 25-year plan. It ended up taking me 26 years to finish my bachelor's.
That's a lucky number. I like that. Yeah. Good job. So what did you have to do to make up for the lack of availability for community access?
Right. So
they had to make concessions.
Exactly. You're right. So we had simulation.
Right.
Oh gosh, yes. I can remember. I was on a pretend bus. I'm watching, on in front of computer screen. And I'm on
bus
a pretend
survey.
Bus. Yes.
Windshield survey. Right. So I did my windshield survey too from the comfort of my own vehicle. Driving around me little town, not talking to anybody, just looking around
looking
outside.
Out your windshield.
Yes. So you did a simulated bus.
And it was you got to pick your avatar.
Oh!
So, of course, I picked this, heavy-set redhead getting up on the bus.
Sims?
Yes! It was actually pretty awesome.
You played the Wii version of a nurse. VR nursing.
VR nursing, yes.
I'm on the bus now.
Awesome.
Oh, my God.
Yes.
But okay,
right.
So all of this, how much did you really get out of it? Or did you just have to suffer through it just to get the grade and get the frank out of there, man?
I'll be honest. Yeah, I suffered through the sim.
Right?
Yeah, but fortunately then, again, that was some things lifted. They were starting to lift through the community. And that's when I was able to get out there. I took literally 2 weeks off work. So I could just go out, right? Remember? Bang, 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 bang. And I went everywhere.
You did the damn thing.
Everywhere. I did it and I finished. Finally got my bachelor's degree when I was 50 years old.
You are 1 degree hotter, sister. Let me tell you.
Oh my gosh.
But think about all these kids.
Oh my gosh.
And these young folks and these kids, because you can now in a lot of places graduate high school with your LVN or with your associates,
so awesome. Yes.
Which is great. Mm-hmm. But what if you have that degree and that licensure and don't have any experience?
Right. Well, so that's why we can't eat our young.
No.
We need to have good nurses on the floor that are willing.
Do that anymore.
I don't think we do either. I think
that's the old guard and they're dying off, baby.
I agree. I think most of them have retired by now.
Yeah. And the ones that are left are stuck around because they're not like.
Exactly. Yeah. No, I do not think we eat our young. I really, really don't. But the number of nurses willing to become teachers, though, I think has decreased a little because
I don't think
so. But the pay is crappy.
That's true, but it's an avenue out of bedside.
Okay, so maybe it's 50-50.
Uh-huh.
Okay, because you're right. Like the folks that do want to leave bedside, that have you have to be at least a BSN, mainly an MSN, depending on who you're teaching.
Yes.
Then that is a great avenue to get out of bedside.
But most of the teachers that I've come across do it either as a night job.
Yes.
Doing the night classes. They're semi-retired.
Okay.
So yeah,
because it's crappy pay.
It is.
Let's be honest.
Real awful pay.
It is. It's shameful. Absolutely
And so
shameful
here these
for
people
teaching this new generation, and you get paid crap.
Let's think about it. So when you have somebody who's underpaid, how much are they willing to continue to invest of themselves into a labor of love?
And put in the extra work and time and care to teach 30 different people that think differently and have
lack
different
of pay
needs
and get the kind of results that you want out of the instruction to a new generation of nurses. Right. So I mean,
it's shameful.
Any profession, not just nursing. Right. You underpay someone, they're not going to give a shit.
Yeah. Oh, absolutely. They're quietly quitting.
Yeah.
Yeah.
They're going to
they'll put in their
just
time.
enough.
Yes. That's
just
exactly
enough.
It.
Right?
As much as I love to teach.
You're so good at it.
Thank you. I love teaching, but I cannot, at this time in my life, I cannot teach nurses because I wouldn't make enough money.
No, it's not financially viable.
Right. I would have to take a demotion to become
Wouldn't you see yourself being a teacher as a way to semi-retire?
Absolutely.
And that's what all the teachers are doing.
Honey, I'd volunteer.
No, don't
God, yes.
say that because then they'll give them goddamn ideas. Stop that.
I love to teach. And yes, if I won the lottery, you know what I mean? Like I would become a nursing instructor. I love to teach. Absolutely.
And the nurses who get to be instructed by you you would breed the kind of next generation of nursing that we would need.
Thank you.
Because
I hope so, yes.
You're not too fluffy. You're informative.
Mm-hmm.
You're not controlling, and you keep it real, but you're able to show compassion. And that's what we need is be the kind of nurse that you want to see other nurses be.
Remember, that's why I became a nurse, literally. Yes.
Oh, mother.
I became a nurse because I wanted to make a difference.
That's right.
I wanted to be a good nurse.
That's right, because you were in the hospital.
Folks, this topic is too huge to tackle in just one episode. So we're going to stop here, but please come back and listen to part 2. We're going to talk about the role of social media in nursing. We'll talk about safe staffing ratios, CEO salaries, Salem witch trials, and more. Folks, this podcast was recorded in my studio on the hill in San Antonio, Texas in January of 2023. It was developed and produced by Mahsa Kharazi and Wound Care Karen, and it was edited by yours truly, and I did it all while retiling my bathroom. The views expressed here belong to me and my guest and not our employers or affiliates. If you like what you heard, please subscribe and give me a 5-star review. If you have ideas for future podcast content, please drop me a line at contact@woundcarekaren.com or message me on Facebook, Instagram, or YouTube. I'm Wound Care Karen, and please remember, folks, time does not heal all wounds. So if that happens to you, please seek help from a wound care professional.